Buprenorphine is a medication used to alleviate moderate to severe pain. It falls under the category of opioid analgesics and works by altering the way the brain perceives and responds to pain. It is commonly used to manage pain in medical settings. It is important to follow the prescribed dosage and timing for the best results. This medication is administered through an injection into a vein or muscle by a healthcare professional, following your doctor's instructions. The dosage of this medication is determined based on your medical condition and how you respond to the treatment. For best results, pain medications should be used as soon as you feel the first signs of pain. Waiting until the pain has worsened may result in the medication not working as effectively. If you suddenly stop using this medication, you may experience withdrawal symptoms, especially if you have been using it for a long time or in high doses. Your doctor may gradually reduce your dose to prevent withdrawal. If you experience any withdrawal symptoms, such as restlessness, mood changes, watery eyes, runny nose, nausea, diarrhea, sweating, muscle aches, or sudden changes in behavior, contact your doctor or pharmacist immediately. Long-term use of this medication may decrease its effectiveness. If you find that the medication is no longer working well for you, discuss this with your doctor. While this medication is helpful for many people, there is a risk of addiction. This risk may be higher if you have a substance use disorder. It is important to use this medication exactly as prescribed to reduce the risk of addiction. If you have any concerns or questions, consult your doctor or pharmacist for more information. If your pain does not improve or gets worse, be sure to inform your doctor. Some side effects of Buprenex 0.3 mg per milliliter injection solution opioid analgesics (IR) with all antitussive opiates, may include nausea, vomiting, constipation, lightheadedness, dizziness, drowsiness, headache, sweating, redness, itching, or irritation at the injection site. These side effects may decrease over time. To prevent constipation, it is recommended to eat dietary fiber, drink enough water, and exercise. You may also need to take a laxative. It's important to ask your pharmacist which type of laxative is right for you. Additionally, to reduce the risk of dizziness and lightheadedness, it's important to get up slowly when rising from a sitting or lying position. It's important to remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. However, some serious side effects may occur, such as interrupted breathing during sleep, mental/mood changes, difficulty urinating, signs of your adrenal glands not working well, fainting, seizure, slow/shallow breathing, severe drowsiness/difficulty waking up, fast/irregular heartbeat, severe dizziness, and liver disease symptoms. It's important to seek medical help right away if you experience any of these serious side effects. A serious allergic reaction to this drug is rare, but it's important to seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed, it's important to contact your doctor or pharmacist. Buprenorphine has the potential for abuse and addiction, which can result in overdose and death. It may also lead to severe breathing problems. To minimize these risks, your doctor will prescribe the smallest effective dose for the shortest duration. It's important to discuss the possibility of having naloxone available to treat opioid overdose with your doctor or pharmacist, and to educate your family members on the signs of an opioid overdose and how to treat it. When starting this medication or after a dose increase, the risk of severe breathing problems is higher, as well as if the wrong dose or strength is used. Using buprenorphine with alcohol or other drugs that cause drowsiness or breathing problems can lead to very serious side effects, including death. It's crucial to understand how to use buprenorphine and which drugs to avoid while using it. Seek medical help immediately if you experience slow/shallow breathing, unusual lightheadedness, severe drowsiness/dizziness, or difficulty waking up. Before using this medication, women of childbearing age should discuss the risks and benefits with their doctor. If pregnant or planning to become pregnant, it's important to inform your doctor. During pregnancy, buprenorphine should only be used when absolutely necessary, as it may slightly increase the risk of birth defects if used during the first 2 months of pregnancy. Using it for a long time or in high doses near the expected delivery date may also harm the unborn baby. To minimize the risk, use the smallest effective dose for the shortest possible time. Babies born to mothers who use this drug for an extended period may experience severe, potentially fatal, withdrawal symptoms. Notify the doctor immediately if you notice any symptoms in your newborn such as incessant crying, slow/shallow breathing, irritability, shaking, vomiting, diarrhea, poor feeding, or difficulty gaining weight. Before using Buprenex, it is important to let your doctor or pharmacist know if you have any allergies or if you have a history of certain medical conditions such as brain disorders, breathing problems, gallbladder disease, kidney disease, liver disease, mental/mood disorders, substance use disorder, stomach/intestinal problems, disease of the pancreas, or difficulty urinating. It's also important to inform your doctor of all the medications you are currently taking to ensure there are no interactions that could cause serious heart rhythm issues. It's important to be cautious while using Buprenex as it may cause dizziness or drowsiness, especially when combined with alcohol or marijuana. It is advised to avoid driving or operating machinery until you know how this medication affects you. Additionally, older adults may be more sensitive to the side effects of this drug. If you are pregnant, it's important to discuss the risks and benefits of using Buprenex with your doctor as it may harm an unborn baby. The medication also passes into breast milk, so it's important to consult with your doctor before breastfeeding while using Buprenex to avoid any potential undesirable effects on a nursing infant. It's important to be aware of potential drug interactions with Buprenex 0.3 mg per milliliter injection solution. This medication may interact with certain pain medications, naltrexone, and samidorphan. It's also important to notify your doctor if you are taking other opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines, as they may increase the risk of serious side effects such as slow/shallow breathing and severe drowsiness/dizziness. Additionally, it's important to check the labels on all your medicines, as they may contain ingredients that cause drowsiness. Furthermore, this medication may interfere with certain lab tests, so it's important to inform lab personnel and all your doctors that you are using Buprenex 0.3 mg per milliliter injection solution. If someone has overdosed and is experiencing severe symptoms such as passing out or difficulty breathing, it is important to give them naloxone if available and then call 911. If the person is awake and not showing any symptoms, it is important to contact a poison control center immediately. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. Symptoms of overdose may include slow or shallow breathing, a slow heartbeat, and coma. It is important to seek medical help immediately in cases of overdose. Sharing this medication with others is illegal and should be avoided at all costs. It is important to only use this medication as prescribed by a healthcare professional. The Buprenex 0.3 mg per milliliter injection solution is an opioid analgesic medication used to treat severe pain. It is also used as an antitussive to suppress coughing. This medication is generally prescribed for patients who require continuous pain relief and are unable to take other forms of pain medication. It is important to follow the prescribed dosage and timing for this medication, as taking it more frequently or in higher doses can lead to serious side effects and dependence. It is typically administered as an injection by a healthcare professional and should not be self-administered at home. This medication should only be used as directed by a healthcare provider and should not be shared with others. This medication is administered in a hospital, clinic, or doctor's office and should not be kept at home. It is not available for self-administration. Buprenex 0.3 mg per milliliter injection solution opioid analgesics IR is used for the relief of moderate to severe pain. It is often used as a pain management treatment after surgery or for chronic pain conditions. The dosage and timing of administration will be determined by a healthcare professional based on the individual's specific needs. It is important to follow the prescribed dosage and administration schedule closely for the best results. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.